March break in Ontario is being pushed back until the week of April 12th in an attempt to avoid a third wave, as new modeling shows more contagious variants are gaining a foothold in this province. The government wants people to avoid traveling during the holiday.
We want Canadians to stay in their communities in this province, not take the risk given the obvious challenge of these new variants.
The announcement was made just before new provincial modelling was released that concluded the highly more contagious UK variant makes up 5 to 10% of all new cases in Ontario.
The new variants of concern that spread so much more easily are here, and they threaten to undo our progress.
While cases, hospitalizations and long-term care deaths are down, the UK variant, which spreads far more quickly, could change that rapidly. In the United Kingdom, the variant caused cases to more than triple in a month.
We face the very real risk of a third wave and potentially a third lockdown. There will be little time to react quickly because of how fast the variant spread.
Variant cases are expected to drive a peak in late February, early March. The key to containing their spread, according to health officials, is to keep the reproductive rate down below 0.7. Currently, it's around 0.8. If it rises to 0.9, modeling concludes it will trigger exponential growth.
Would I like it already down at 0.7? I sure would. I think we can get there.
But keeping the reproductive rate down to 0.7 has rarely been achieved during the entire pandemic. And while health officials say the stay-at-home measures would help contain the virus, the province is in the process of lifting them.
There are a number of things that need to be weighed in making these decisions.
Next week, after Family Day, all regions except for Toronto, Peel and York will have the stay-at-home order lifted. And tomorrow the government will announce what color they will be placed in the framework. And the government made an embarrassing mistake today. It announced this morning that it met its target and every long-term care resident had received their first vaccination. In fact, they have not in at least 2 public health units. The government blamed miscommunication. Now, it has taken a lot of criticism for being far behind other provinces in vaccinating elderly residents. And one last note on March break being postponed, teachers' unions have come out strongly opposing the move, saying staff and students need a mental break.